Just going to check if my mic's working. Am I audible? Can you hear me? Oh, I don't think I can hear you. Hang on. Oh, perfect. Thank you. Oh, Holly's just looking.
Are you okay?
Hi, can you hear me, Holly?
Yeah, perfectly.
Wonderful. That's fine. Lovely. I'm going to give it to at least 8 o'clock before we start anything. I'm going to try to share my screen now. Oh, hang on. This wants me to just grant permission to share the screen. Yeah, done that. Sorry, it's going to make me quit and reopen. I won't be a minute, Holly.
No worries.
Can you see that now, Holly, on your screen?
You're still frozen from when you left, but I'll give it a second.
It's only showing you, actually. It's not showing me in the actual room. Oh, there we go. Got it back. I'll just see who else we've got now.
You're still frozen on my end.
Okay. I'll just open the chat. If anybody else is in the meeting, can they just type in the chat if I'm still frozen? Still frozen. Right, okay. Let me leave and rejoin again. There we go. Can you hear me, Holly?
Yeah, I can hear you, but
Can you see me?
I can see you frozen.
It says that someone else is using the same login as me. So I don't know if anybody's logged in with that guest acre login. It's saying it's open on someone else's device.
So let me log out because I shouldn't have it open.
Am I back now? No.
Give me 2 seconds.
You're all right. Oh, I'm back now. Someone telling me I'm unfrozen now, so hopefully it's working. Okay, so I will try and share my screen again. There we go. Can you hear me?
Yes.
And you can see me?
Yes.
And can you see my screen?
Yes.
Oh my God, we've got there. Okay, I'll still give it another few minutes though, because it's only a minute too. Still invitations going out, so I'm just going to leave it until these people have joined. Okay, I think we're all set up now to get going. Hi everybody, my name is Natalie. I am rubbish on stuff like this, Teams, presentations, etc. So I apologise if things get frozen or the presentation doesn't quite work. We'll just chat if that happens. What I'm going to suggest we do is, I would love for this to be really interactive, but I think there's going to be far too many people for us to actually chat. If throughout the presentation you think of a question, a comment you want to make, if you pop it in the chat box, and then we'll come back to it at the end, if that is okay for everybody. I don't know how to split my screens and make this appear alongside the presentation, so I'm just going to try that now, actually. Hang on a second, pray from the start. So, okay. There we go. So I will close this down and we will start the presentation now if everybody is ready. Right, okay. So this is a Jalupro Young Guy presentation, but I've adapted it for my experience of Jalupro Young Guy and give everybody a kind of overview of the whole range as well. That is okay. So close that down. So who am I? I am Dr. Natalie Howarth. I am a full-time aesthetic physician. I've been injecting for about 10 years now, full-time for about 7, and I own the doctoring company, which is skin clinics. So we do everything from skin, injectables, laser, facials, Morpheus, things like that. I have recently started using Jalupro, only this year actually, and been pretty blown away by the results, technology, but the company's stance on natural aesthetics and the way that aesthetics is moving and how they are open to change and moving with the times, but also how the company is very, I would say, kind of honest about what their products can do, but also what about their products can't do. I know that all of you, and I know especially myself, you get approached by companies on a daily basis from other fillers, from skin boosters, from other technologies, you know, sometimes some really dodgy ones that come in, slide into your DMs. But there seems to be a new product on the market every single day. And there's always kind of a, well, where does this fit the gap? What do I need this for? Do I need to stop using something else? And what I was so impressed, there was a kind of a turning point with me and Jalupro was when Angel, one of the medical leads, said, this is not going to replace other products. You use this alongside. And I loved that idea of this being a complementary treatment, and that it works in combination with other treatments as well. So we're going to concentrate on the eye area because that's what obviously Young Eye is intended for, and why the eye area is so important. And one of those is that it is a physical and emotional extension of your brain. You use it to explore the world, you use it to talk to people, it's a social cue. It's the first area that people concentrate on. You have lots of studies around the kind of the point at which people look at when they're having conversations, and around 80% of that is around the eye area. And it's also been a point of cultural change from, you know, kind of evolution of the human species. We've concentrated on the eye area, and you can see that culturally we kind of celebrate and decorate that, especially in women. And I know that for myself and the majority of injectors, women take, you know, they're around 85% of all patients in my practice. That's a little bit higher. That's around 95% of my patient demographic are all females. So why do we consider the eye area to be in aesthetic, you know, in need of aesthetic treatment? And that is because it is the fastest aging part of the face. The skin is the thinnest part of the body, and the skin is naturally thinner. It's also has less fat pads, it has less collagen and less elastin over time. It's also a highly mobile area. It has a lot of function. So it has a lot of function with blinking, with emotion, which I think is on the next page. So it has functions for facial expressions, for blinking, and also for the light and sun. So you use that as a protective mechanism when the sun is high in the sky, you tend to squint a lot, or if you've got a bright screen, you will be frowning and squinting as well, which obviously wrinkles up your skin and leaves those wrinkles sort of lasting over time. Emotions, obviously, most of your emotions are shown in your eyes, whether you're cross, whether you're happy, whether you're sad. And these are what we know our patients come to see us say, you know, I've got a frown line, I've got lines on my head. And these are how they rock up in clinic. I'll not show you a video of blinking. I'm sure you all know what blinking is. As we've already gone through, light and sun cause us to squint and frown and cause lines in the area. So Jalupro Young Eye was brought about around supporting the eye area, supporting the skin, and to improve the sort of texture and attractiveness of the area. One of the things that Jalupro were really insistent on, and you see this the more you treat patients with young eye, is that this is not just an under eye treatment. And we get lots and lots of patients through the door where the concern is the majority of it is the under eye, but this should be seen as a periorbital treatment. So a treatment for the whole eye area, around the brow, around the upper lid, and even extending up into the temple as well. So I'm going to go through now a couple of the other Jalupro products, which I know that a lot of you are probably using already, but just where young eye can fit in with the rest of the Jalupro range, but also the rest of the aesthetic menu that you have in your practice. The patients will come to you and say, I look tired, I feel old, I feel sad. They don't necessarily describe to you an anatomical sign of aging, and it's down to you and your consultation process, where you will elicit the actual problem that the patient wants to express. If someone says to you, I look tired, you need to pin them down on what they mean by that. And that might be pass them a mirror, get them to describe, is this from fine lines? Is this from darkness? This is a shadow. Because that way you are always going to match their agenda with yours, and that will give you someone who leaves feeling more confident and happy with the treatment versus I didn't get what I want, and which can obviously always result in complaints. So the aging process of the periocular area, I won't bore you with this. I'm sure you all know your anatomy, but you see you've got brow ptosis, hooding, you've got malar mounding, you've got the orbital rim indentation, which a lot of people describe as a tear trough, and that's from a loss of collagen in the area, a loss of the periorbital fat, and then eventually you get bone erosion where your orbit gets bigger. This is one of the systems that you can use to grade the severity of that, type 1 all the way to type 4, and it's a great thing to do to be grading your patients' problems, because you can see improvement over time, and this is also part of the way that we judge success of treatments. So if you ever take part in any clinical research, you'll know that grading systems are kind of inherent to prove aesthetic outcome, but this is a great way for you to demonstrate your patients where they are in that grading system and then give them realistic expectations at the end. So these are the kind of 5 common cosmetic concerns that people will come in with, and whether that's translated from I feel tired and old, these are the things that you want to get out of them. Is it skin quality? Is it having puffy eyes? Is it having dark circles? Is it the fact that they've got a tear trough deformity under the eye? These are your patients who really you don't want to be touching. This is a definite surgical patient on both slides, where you're going to have limited to no improvement with kind of any aesthetic treatment, or actually you may even make things worse. So these are your surgical referrals. So we'll start with dark circles and how you can classify them, the cause of them, but also how you can assess them. So you might have somebody who has excessive pigmentation. This might be vascular, so you can see the vascularity through thin skin. This might be just thin skin, where you're seeing not excess vascularity, normal vascularity, but the skin is extremely thin. Or you might have a shadow, and that's where you've got the orbital retaining ligament laxity, where you get more of a tear trough than anything else. So how to assess a pigmentation. This is something that's quite important for you to document for your patients, but also it will dictate your treatment path thereon. So you can have true pigmentation, which when you stretch will retain the appearance in the skin. If you have pigmentation from having thin skin, where the pigmentation improves, or if you have pigmentation that worsens when you stretch the skin, that is probably vascular in origin. So it's a nice little kind of system to put your patients in. So where do where does Jalupro come into all this, and why is Jalupro has been made the way it has? So Jalupro throughout the range is utilisation of amino acids, peptides, and hyaluronic acids. So going back to basic science, med school, nursing school, amino acids increase the amount of collagen, elastin, and fibrillin by both indirectly and directly supporting the tissues. So you have the fibroblast is stimulated to produce collagen and elastin. The amino acids actually are the raw ingredients for the fibroblast. So you then have the raw ingredients ready for when the fibroblast is stimulated to produce more collagen and elastin and fibrillin. Amino acids also have indirect effects on the skin because they are also anti-inflammatory and antioxidant as well. So even when they're not being utilised by the fibroblast, they're also having action on the skin too. So the way that they have action in the periorbital region specifically is they thicken up the skin due to collagen synthesis, and we all know that the collagen in your dermis is what supports it and makes you have less wrinkles. The strengthening of the blood vessels, so improvement of the vascularity in the area. You get thickened walls of the capillaries because the collagen fibres are in the capillary walls. And it also has an immediate effect on the microcirculation as well because it's a potent anti-inflammatory agent. How does the amino acids help lighten the skin? So you have the lysine precursor of tranexamic acid, which we know inhibits tyrokinase activity, which prevents melanosome activity. You also have glutamine, which induces your macrophage migration into the area, which then induces hemosiderin uptake. So you get actual, if you imagine the macrophages actually eat up the pigmentation, and that's what helps lightens the skin. So this is a result with actually Jalupro Classic and not Jalupro Young Guy. So if you have a patient who is not necessarily a skin laxity problem or a skin quality problem, but they may have pigmentation, they're not necessarily a tear trough candidate, Jalupro Classic would be a great treatment in this area. You can see the effects on this before and after. So another area where we use Jalupro, and this is what I was talking about at the beginning of the slides, where I like how flexible Jalupro can be. And this is where you can use Jalupro Classic in combination with toxin. So this is about the Duchenne smile or the SMILES. So this is where we have patients who, and you'll see them all the time in clinic, they come in and say, I've been having crow's feet toxin, it's not doing its job anymore, or it's wearing off, or I've still got lines. And you can increase the dose, you can increase the quantity of toxin that you put in, you can make the dose spread a little bit wider, but what you end up with this is this fake smile, where the smile doesn't quite reach the eyes, and that's what you'd call a SMILES. So it's just across the smile and doesn't get all the way up to the eyes. And this is where we want to reduce the toxin dose that we're giving to give patients a more natural looking smile, but increase the skin quality at the same time. And this is where you can use Jalutoxin. So this is a treatment protocol where you mix Jalupro Classic with mesotoxin. So that's very low dosage and low quantities of toxin. This is an off-label use. What I really like is that Jalupro are kind of willing to put themselves out there and, combine therapies that, isn't necessarily part of the treatment offering, but we know would help patients achieve what they wanted to in the eye area. So these are some of the example doses that you could mix with Jalupro Classic and inject in a mesotherapy format. And you can see here, this is the kind of the mesotherapy format that you would use. Very small needle, very superficially, and using 0.5 ml per side. And you will get that improvement in skin quality. This is from the protocols, the safety things to be discussed, but I just wanted to show you the before and after, where you can see the action hasn't completely disappeared, especially on the left slide. You can see that the orbicularis oculi is still, kind of pulling the smile upwards, but the skin quality has drastically improved as well. So where you have shadowing due to ligament laxity, so this is what we were talking about towards the end of the causes of eye problems, where you have the orbital retaining ligament has become lax, then you get the kind of fat pad descending and kind of being suspended over and giving you a shadow underneath. So we can improve the quality of the ligaments, the facial ligaments, the retaining ligaments that make your skin and superficial fat pads stay where they are, and we know they descend over time. And we can do that by improving the ligament quality, improving the collagen in the actual ligaments themselves. So you can see here, you can inject either at the distal end of the retaining ligament, or you can actually inject deep and go right to the periosteal origin of the retaining ligament. And we do that by using Jalupro Super Hydro. So this is one of the treatment programs that you can use. And this indirectly treats the eye area because it's going to produce a lifting effect. So improving the quality of the ligaments in the area so you don't have that shadowing under the eye. This is the lift protocol, and what you also have is the eye lift protocol, where some of the Jalupro Super Hydro is placed in the supratemporal septum, and you have lift in that area to improve the ligaments underneath the eye as well. So I'm kind of skimming through all the other Jalupro products so we can get to the young eye, which is obviously why everyone is here. So this is the Jalupro Super Hydro, which has been around for a while. So we've already talked about the Super Hydro and the Jalutoxin. We're going to move on to the actual Jalupro Young Eye now. So this product was devised using the amino acids, peptides, and hyaluronic acid with the idea of anti-aging the whole periorbital region, but maintaining the hydration and reducing the swelling that can come with a lot of periorbital treatments around the eye. So there are 7 amino acids, 3 peptides, and a bi-density low molecular weight hyaluronic acid. So you have the hydration without the puffiness. And I'll go on to that towards the end of the slides about my experience with that. It's a pre-filled 1 ml syringe. So if you're used to using Classic or HMW and you're mixing things up, this comes in the box already. You don't get any needles in it, but I certainly use kind of a 33 gauge TSK or a nano needle, something that's going to be really comfortable for the patients. And you're also injecting in incredibly small quantities, so you do want something short and very thin as well. It's ready to use product for both eyes. You get a full mil and you can use half per side. And this is the treatment protocol. So this is the injection technique. You know, the Jalupro suggests 32 gauge, but I use a 33 or a nano needle on a 4mm length as well. So this is different to the rest of the Jalupro range and the Classic range because it has a very different makeup of amino acids and peptides, and they're concentrated in different ways to help anti-age as well as helping the dark tissue around the eyes, so the pigmented tissues. And this would be for your patient who is typically maybe a previous toxin patient or a patient who comes in and you think you could have some toxin, but they maybe don't want it. They don't want to change the way they express themselves. They don't want people to ask them what they've had done. And this would be a great treatment protocol for them to improve the skin quality and the tightness in their area. And one of the other things that I think Jalupro Young Eye will offer to patients that you don't generally see with other sort of injectable treatments is the upper lid and temple treatment. So on this picture, you can see you can go all the way up to the mid-pupillary point on the upper lid, but you can also extend this up into the temporal region at the side of both eyes to give your patient that lift and improvement in skin quality. Because we all know as well, when we get some patients to squint, some of those crow's feet are extending up into the temple where the orbicularis is pulling the tail of the brow down as well. So you can extend that treatment plan around into that area. It's quite an intensive treatment plan. You're looking at 3 treatments, 1 to 2, up to 3 weeks. I will go up to apart just to give your patient that kind of, you know, gap in the downtime in between. And then you can maintain anywhere from 4 months to kind of once to twice yearly. And this is where you talk to your patients about this being a journey and not a one-stop treatment, because things are only going to get worse with that quality of skin around the eye. The collagen's only going to deplete. If you've got a perimenopausal patient, they're going to go into the menopause, the estrogen's going to plummet, and the collagen alongside of it as well. So move on to, so this is the safety slide where we talk about kind of patients who aren't suitable or patients who are suitable. And in my experience, even when you have patients who maybe have a very slight malar edema, or even kind of, you know, directly under the eye, they have some edema, I haven't seen any problems with this. If I've got someone who does have a malar mound with edema in it, I will avoid it. I'll pencil around it and make sure I go kind of stay clear of it, stay above and maybe stay medial to it. But even with patients who do that, have that little bit of excess swelling in the mornings, I have still injected those and been really happy with them. Another thing to think about is, has your patient with you or with someone else had extensive toxin treatment? If they have very little to no orbicularis squeeze, they're going to have extended edema and puffiness. It will not stay forever, but it will they maybe have slightly more downtime than your average patient because they don't have that squeeze in the area and the lymphatic drainage to pull the excess fluid away. Your usual contraindications: pregnancy, breastfeeding, autoimmune conditions to be considered, maybe anticoagulants, things like that. But otherwise, this is a very kind of kind, gentle treatment where you're not having drastic side effects or complications. So where this kind of fits in with the rest of the range of Jalupro, having a full range of treatments, where you've got skin quality improvement with H&W and Classic, and Super Hydro being your deep biorevitalizer to lift your patients who do want that lift. And the Young Eye fits in being that kind of periorbital treatment that is a one-off on its own, because we know that patients come in and it is that key area that they want to improve. And I know from myself, it's been somewhere where I have found that I'm lacking with a treatment offering for them. I'm saying, well, we'll try the toxin, maybe we'll try some microneedling, but they're seeking those injectable treatments that can improve it, that isn't just toxin. And this is where I was going to talk about my experience with Young Eye, because I had it for a couple of months before it was on general sale, but it's kind of new to everyone, and there are very limited before and after pictures because it's new to the UK. This is one of my own before and after pictures, and you might recognise Justine from Acre. She has had great results, even with, she's between treatment 2 and 3, but this is after only 1 treatment, and you can see improvement in skin quality, and even around the brow, just under the tail of the brow, you can see how that skin is just tighter, and she's really happy with it. So I was looking for something like Jalupro Young Eye at the time. I found it, and it was all about patients having that missing piece of saying, I need something else around my eye other than toxin. And we know toxin has its drawbacks. We've already talked about the fact that people don't feel like themselves sometimes when they have excess toxin in the orbicularis region. And there is you do have those patients who just want what is next. You might hold back thinking, well, you've got good results with toxin, you've got good results with some retinol and some, facials and maybe some radiofrequency, but they want to know, well, what else have you got any training? They're that kind of seeking the next thing. And for me, this has been a great solution for those patients because it has limited downtime, low complication rate, and great results. But what I will say is, and one of the reasons why I was so happy to have Jalupro in my clinic was their attitude to it as well. Was if you have someone who's happy with toxin and microneedling, or if you're thinking about using Super Hydro and they're happy with Profilo, don't switch them. They are happy, leave them on it. This is not going to be revolutionary for them. It's not going to be drastically different, and that's why I was so impressed with Jalupro, because you don't see that from many companies these days. They kind of, when you're talking in training about other products, it's kind of like it's a swear word, and I really enjoyed that isn't the case with Jalupro. It's a really flexible product, so I have done probably 5 Jalupros at Young Eyes in the past couple of days, and the treatment protocol will vary patient to patient in just terms of where you inject. Am I going higher up onto the temple? Am I sneaking into the forehead because they've got some lines there? Am I concentrating a little bit more on the under eye region? Am I leaving the lid alone because actually it's fine and it doesn't need much collagen stimulation? And I really enjoy that, being able to move things as to where my patient needs them. It's not a strict protocol. When you inject your patients with Young Eye, and I've posted lots and lots on Instagram about this, they look kind of stark to begin with. They have lots and lots of angry papules, and it goes right up to the lash line, and they can feel a bit, I can almost see my skin when I look downwards. What is amazing is that if you use the Jalupro mask, which I do straight away after treatment, and kind of, it's a biocellulose mask, press those amino acids into the skin, and then we pop the patients under the Dermalux after the Jalupro mask. When they're leaving, so they've been with us maybe an hour and a half, they look normal again. The swelling goes down incredibly fast. And every patient who we've seen with Jalupro Young Eye said, yeah, normal the next day. They might have the odd bruise, but they are very superficial. These aren't deep hematomas. These are tiny little pinprick bruises, and they clear incredibly fast. So you find that downtime is really low with this treatment, even though as soon as you've injected them, you think, oh my God, they look horrendous. But within hours, they are back to normal. And it fits nicely in with other treatment plans. So I routinely do Jalupro Youngi and do toxin at the end of treatment, then I'm not having to drag my patient back, and we've had no problems with that. I just tend to lower the dose on the very end, the lower injection point on my crow's feet until the review, and see what's happened. I don't want to completely obliterate that abicularis squeeze if I'm loading them up with amino acids and a little bit of HA as well at the same time. I steered clear from this with patients who have been distressed by previous edema under their eye. So I said earlier, I've used it on patients who do have malar mounds and a little bit of edema. If I've got a patient who, they had previous tear trough and were very upset when it went puffy, I've said kind of this probably isn't for you. Well, let's look at something like a polynucleotide that doesn't have any form of HA in it. I have used Youngi on patients who've had previous tear trough, maybe not in the past 6 months, but they've had them in the past and had no complications with it. I would say ideally you would pre-treat your tear troughs with Youngi, improve the skin quality, improve the collagen and the thickness of the tissue. And if they still have a hollowing, then go in with the tear trough filler. I would try and do it that way around, which is difficult because, this is something that the patients are going to have to wait for the improvement in, whereas tear trough's kind of an instant result. But you have to, consult your patient around that, this being a journey and a long game rather than, a one-stop treatment, and it's fitting in with the rest of their aesthetic treatments as well. We've ended up at the end of the slideshow. That's gone a bit quicker than I expected. I'm just going to open the chat now. So, does anybody have any questions about that? I don't think there's anything in the chat so far, or anything they want to ask me in general about Jalupro, anything.
There is one in the chat.
Oh, I can't see it. Oh, there we go. Sorry, I'm having to scroll back up. If doing the BAP method of 7 out 3 sessions, how long after this can you use it? I'm going to be honest, I don't use 70 high out, but I routinely do Jalupro Youngi with Superhydro. I've done it with Profilo. So if the BAP method is similar to Profilo and Superhydro, I would assume you could do it in the same session. But like I said, I don't use 70 high out, but I do Jalupro Youngi in the same session as Profilo and Superhydro and Toxin as well. So Acre are the official distributors of Jalupro, so you can get it exclusively on their website. So Superhydro can explain the protocol. So yeah, there are 2 different protocols for Superhydro. So you have the lifting protocol and you have the eye lift protocol. So I will flick back in a second to share my screen. So you have a 2.5 ml syringe with Superhydro, and you have 6.2 ml boluses on the lift protocol and a 0.1, and then that changes with the eye lift protocol. You end up putting an extra 2 points around the eye up into the temporal ligaments so that you get the lift by revitalizing the ligaments up there. If you've used Profilo, it's similar in terms of the BAP method, but these are slightly more targeted to the ligaments themselves. The extrusion force is less, so your thumbs don't hurt as much, and the patients report the pain is much less as well. We'll go back to, so I've never used Jalupro on a client who had one treatment just in suffered edema from that now into the eye got worse and baggy, what went wrong. Do you know what Jalupro that was and what of the range that was? I would be very surprised to hear that it was any of them, because it's mainly amino acids and peptides rather than, there's no cross-linked HA in this, so there should be nothing that is hanging around in the tissue to cause excess edema. So I'd be surprised to hear that, but it'd be worthwhile looking at what other treatments she's had at the same time, because even if you thought about reversing that with Hyalase, there's no cross-linked HA in it, so you shouldn't get any residual HA hanging around. The other explanation is that if they've accidentally injected into the malar mound, you may have uncross-linked HA stuck in the Mail-A-Mound process with poor lymphatic drainage, and then yes, you will get edema. So it might be worthwhile referring her for an ultrasound scan to see if someone can find any residual HA sat in the Mail-A-Mound, or even much more simply, trying some hyalase directly into the Mail-A-Mound and see if that helps things, and that will get rid of any even uncross-linked HA that's just managed to make its way into there. Does a protocol come with a young guy as shown on the PowerPoint? It doesn't come in the box, no, but you can get that via Acre Pharmacy, so we could send that out. This the actual presentation has been recorded, and we will send out the protocols as well after. The other thing to note as well is that the as part of your insurance stipulations, you'd need to be practically trained on this as well. So we can organise that for you as well. We have training on next Wednesday evening in Manchester as the first young guy training in the UK. So with myself, I think there's a few tickets left. You might have had it on an Acre email. If not, we can forward that to you. So you will learn the Jalupro Young Guy and Super Hydro protocols. You will then get the slides sent to you. You get your own patient, you can inject them, and then we've got an influencer event on after, so you can hang around. And as we all know, you need content for social media, so there's kind of content opportunities. So yeah, you do get the protocol if you come on the training too. Right, let me move down. So charging for Super Hydro and Young Guy, we currently have them on an introductory offer. So they are 3 Young Guys for $6.50, which includes the amino acid mask and a Dermalux treatment afterwards. But when that comes off the introductory offer, we will be doing it at $7.50 for 3 treatments without any mask or Dermalux. That will be as an additional cost. So I think I would say traditionally you would market these around your skin booster price points, but with the knowledge that if patients are buying up front, they tend to to have a saving with that as well. So yeah, that's where we're putting them at. No, I wouldn't aspirate when administering Super Hydro. It's not cross-linked, and there are no cases of vascular events with any of these. A little bit like with Profilo, it's uncross-linked, shouldn't ever, even if it was moving through a vessel, it would move out and it could be massaged. The advice for aftercare is that if you're ever concerned about anything like that, it's probably just a hematoma, but heavy massage to any area that you're worried about. But there's no evidence of that at all because it's uncross-linked. Any plans to Scotland training? Not by me, I'm sorry. It's something that we can put to Acre and see if they can organise training up in Scotland for you as well. But yeah, not with myself at the minute. I'm sorry. I'm down in Lancashire, but our training all happens in Manchester. I'll just make sure I've not missed any. I think I've answered all of the questions. So if anybody else has anything else before we go, you're very welcome, April. No, I'll just give another couple of minutes to see if there's any more questions. Brilliant. No problems. So like I said, we do have the hands-on training. Yes, we could definitely put on other similar webinars. We could even put them on the individual products. So if you wanted to do just Jalupro Classic, just Jalupro HMW, just Super Hydro, we can put them on webinars, kind of individually. The training next week is we'll put out an email after this webinar now. Actually, I think Acre are going to be on with that, where you will get a link to book the training. It's an Eventbrite ticket. It's £300 for the training, but you get £200 back in an Acre Jalupro voucher as well. You get your own models, and then you also get CPD accreditation as well, because our academy is CPD accredited. But you'll get an email following this webinar, and that will have the link to the practical training as well. Oh, there we go. Like magic. Holly's put a link to the training with myself for next week. Just make sure I've covered everything. Oh, thank you very much to everyone. Wonderful. Thank you. I hope you all have a nice evening. Thank you.
Thanks, Nat.
Thank you.
Bye.